Hello students, now we are going to discuss about the buffer in pharmaceutical system, right? So in pharmaceutical system we are going to have the different types of dosage form like solid dosage form, semi-solid dosage form, parenteral products, and ophthalmic products, right? So in those kinds of formulation, what is the role of buffer? As we know that buffer is something the kind of solution which resists the changes in pH when acid or base is added to it, right? So what is the kind of resistance it is required, because different pH of the body it is maintaining. Maybe for tear pH will be different, blood pH will be different, so in that way. Okay, now coming to the solid dosage form. So in solid dosage form, buffer have been widely in solid dosage form such as tablets, capsule, and powders for the controlling the pH of the environment around the solid particle, right? So that's what buffer is having major role here, because the pH is also a pH of the environment. It has to be maintained first of all, right? This has a practical application for the drug that have dissolution rate, limited absorption from the unbuffered solution, right? So if it is unbuffered solution, the dissolution rate, because so many drug it has to dissolve in the stomach, some drug it has to dissolve in the intestine, so in that case also it has to be think properly. One of the special application of buffer is to reduce the gastric irritation caused by the acidic drug, right? Because stomach environment it is acidic, so gastric irritation it may cause because of the acidic drug, and the acid, already acid is there in stomach and drug is also having acidic nature, so that can a buffer it is there, we can maintain the particular pH. For example, sodium bicarbonate, magnesium carbonate, and sodium citrate, these are antacid are used for the purpose of reducing toxicity, right? So here in solid dosage form the buffer is having major role, where when we come to the semi solid dosage form, right, it is not complete solid, it is semi solid, right? So semi solid preparation, for example cream and ointment, undergo pH change, they are also undergoing pH change upon storage. Of course in storage only this thing happen, for long storage for the long time, right, resulting in its reduced stability. The stability it will be compromised, it will reduce. Hence the buffer such as citric acid and sodium citrate, or phosphoric acid and sodium phosphate are included in this preparation, so as to maintain their stability or maintain their pH during storage and during usage. The third one for important pharmaceutical product, it is parenteral products, right, which we are giving by the by injection or saline, like intravenous, intramuscular, subcutaneous, different route of administration you might have studied in pharmacology. So by using those things, use of buffer is common in the parenteral products, of course, because they are going directly into the contact of the blood, and it has to be maintained the pH, otherwise it will create the problem, right? So since the pH of blood is 7.4, so these products are required to be adjusted in this pH, then only it will be good, or it will be compatible with the blood or circulatory system, and it will show its action, otherwise it will be a problem, right? Change in pH to higher side, like more than 10, right, may cause the tissue necrosis, right? More than 10 means it will be more basic, right? So it will cause tissue necrosis, and it may be problematic, or adverse reaction it may occur, right? While the lower side, like below 3, means too much acidic, it may cause pain at the site of action, right? So pain you may feel, that will not be because of the drug, because of the pH, the changes in that. Commonly used buffer include the citrate, glutamate, then phthalate, and the acetate. The pH optimization is generally carried out to have better solubility, better stability, and reduced irritancy of the product, right? Then fourth one, ophthalmic product like eye drop, ear drop, and nasal drops, right? All those things. The purpose of buffering some ophthalmic solution is to prevent an increased pH can affect both solubility and the stability of the drug, right? The decision whether or not buffering agent that may be added, what you call, right, to be added, preparing on the ophthalmic solution must be based on the several consideration. Normal tear have pH about 7.4, right? and it possesses some buffer capacity. So here in the blood we have seen the pH is 7.4, in the here tear pH it is 7.4, right? So these things has to be because the body it is maintaining the particular human body, it is having different types of the part which is maintaining the different pH, right? So whatever the formulation, if it is blood or if it is eyes, or if it is ear or if it is heart, right? So what do you call it, stomach or in intestine, different pH it is going to maintain. So the drug, where it is going, the drug is going to dissolve, and which part it is going to have the action, accordingly that pH has to be maintained, so that there will be no problem and it will be compatible at that particular site of the human body. So that's what buffer is having important role to play into the pharmaceutical formulations. Thank you.